Well, it is once again my privilege, my delight, my honor to welcome to Bob Burney Live Dr. Carey Girgis at Back Pain Relief, Ohio. Dr. Girgis, it is always wonderful to see you. It's always great to have you on the program. Thank you for coming.
Hey, thank you, and it's an honor to be on your program.
Well, can we talk about neuropathy?
Sure can.
Okay, now listen. When I think chiropractor, I do not think neuropathy. I think back pain, shoulder pain. I think of different pains, but I never ever think of chiropractic care and neuropathy. But this is a real significant portion of your practice, right? Neuropathy?
Absolutely. Well, neuropathy historically has been known to have been caused by diabetes or a patient who is diabetic, and we don't treat diabetes. This is a medical issue. Or toxicity of drugs or anything like that. But really, there's the one area that is mostly neglected is the nerve root compression in the spine, because some people that are not diabetic, yet they have neuropathy. And that is because their spine, in the lumbar spine or is in the cervical spine, compresses the nerve, causes the nerves to die just as much as it does in diabetes, and causes neuropathy. That's one of the reasons why it could be in the feet or the hands.
It's one of the reasons why I love to be around you. I always learn so much because I've always thought if you have neuropathy, you are diabetic. And if you're diabetic, you are doomed someday to get neuropathy.
And that is a lot of it that happens. The majority of the people do have neuropathy and related to diabetes, but not all cases, because nerve can be damaged and injured by a myriad of conditions. Any trauma, burns, toxicity, chemotherapy, all kinds of conditions that could cause the nerves to begin to die off. And once the nerves die off, your communication between whether your feet and the brain or the hands and the brain begins to diminish because those nerves die off.
Well, I want you to share with our listeners a story. And I'll be honest with you. I believe you. I trust you. But I would not have believed this story if you had not shown me the actual pictures. And I'm talking about the lady with the blue feet. You know what I'm talking about?
Yes, I do. I remember clearly. Actually, she came in using a walker, and she was having a hard time even navigating because every step she took was in pain, and she has been through the route of all the medical route with the medications, anti-inflammatory, painkillers, and nothing was really helping to help her. Physical therapy and nothing, and somehow found out about us and came. And when I looked at her feet after she took her socks off, her toes were literally blue.
I saw the pictures. I saw the pictures.
And that is obviously a prelude for gangrene setting. And many people, because of neuropathy, ignore it for a long time. They can have amputation of their toes or the fingers.
Well, I'm not a doctor like you are, but when you showed me that picture, I thought, she's close to amputation. Yep. And again, I'm not a doctor, but that was my first thought. She's close to amputation.
Yes, that is when the condition is ignored for a long time, because usually it starts insidious and it's slow. And people ignore it because of this or that. I put my foot the wrong place, or I have not feel comfortable, or something happened, and they keep ignoring it. And then when they go the medical route and they get medication and they're supposed to help them and it doesn't work, they end up giving up and think this is the way things are. But thankfully, that isn't the situation turned out with that lady.
And then you showed me a second set of photos, and I thought, this cannot be the same woman. This cannot be the same feet. Yeah. Tell me what happened. How did you treat it? How long did it take?
Well, we treated her for over 2 months at that time. By the time I took the second picture, we take a pre and post pictures of the conditions, especially things like that. And I wanted to see for myself how we progress in the recovery of that condition. And we treated her for 2 months and aggressively. Then after the treatment was done, her feet became as normal as you can get. And like you saw in the pictures, she restored after as a matter of fact, she progressed from having a walker to starting using a cane. And we worked on physical therapy and rehab and give her the strengthening. And one day, she walked out of the office and left her cane.
Oh, my goodness.
She forgot her cane. She came back and said, I forgot my cane.
Well, this can be a serious condition, but Doc, so many people put it off. They don't want to deal with it. I recently preached at a church in a certain city. I don't want to give too many details, but an elderly woman just recently was coming to a function at the church. She could no longer feel her feet, but she didn't want to stop driving. That was her independence. And evidently, she didn't know how to get treatment for her neuropathy, but she couldn't feel her feet. And so she comes into the parking lot of the church. She can't feel where her foot is. And instead of pressing on the brake, she pressed on the accelerator and she drove into the sanctuary of the church. Praise God.
Oh, wow.
No one was hurt.
Wow, thank God.
But I think there is something in us, Dr. Girgis, where we think if we just wait, it'll get better by itself, but it doesn't get better by itself. So what you're saying is people listening to you and I talk, they're experiencing neuropathy. There is hope other than drugs.
Absolutely.
Which are usually temporary and not really very effective.
Absolutely.
That's what you're telling me?
That is exactly right. Because there is hope. There's a ways, technology. We have state-of-the-art technology that we're able to help recover some of these nerves that are dying, restore them, bring in oxygen and treatment, or bring in the circulation into the area and do the rehab that is necessary to try to reestablish the pathways that are neglected and destroyed between the feet and the brain, or the fingers and the brain. We restore the pathways, and the patient's able to recover. Their balance improves, their stability, they stop falling and hurting themselves, and really changes their whole quality of life.
So am I right in saying that God has created our body in a wonderful, miraculous way to treat itself,
Yes.
to heal itself,
Yes.
but the scientific treatments, therapies, modalities that you use unleash the God-given body's ability to heal? Is that correct? Am I off on that?
And where do we get science from? Science is only given to us by God. God give us the inspirations for those scientists to discover these things. So we're using God's gift to us. So we use those things to help the body heal on its own terms. And really, if you provide that proper environment, the body heals. The nerves regenerate, and you restore to life.
Okay, we've got about 1 minute left. We usually think of neuropathy with the feet, and we know because we either have terrible pain, tingling, or loss of feeling.
Yes.
But it can be other parts of the body as well. How can you know that you are dealing with neuropathy and not something else?
Well, you have to evaluate it. We have to come in, get an exam, and we do some testing that helps us find out where the source of the problem is. And once we know where the source is, we're able to treat not just the condition itself, but also the source of where it's coming from to help it so that it doesn't come back, and maintain it for the rest of their life.
So all of this begins with an initial exam.
You got it.
Initial exam.
Yes.
Folks, listen. You can call right now, 614-890-3500. The folks at the front desk are so kind, so gracious, and very knowledgeable. Ask your questions and then set up your initial exam, and you're not going to talk to some assistant. They're going to talk to you. Is that right?
That's right.
Call 614-890-3500 right now. Set up your initial exam, or you can go to the website, backpainreliefohio.com, backpainreliefohio.com. Again, Dr. Girgis, thank you not only for coming in today, but once again, thank you for helping so many of my listeners have a much, much improved life. Thank you.
And thank you for giving me the opportunity to share that with your audience.
My pleasure.
Thank you.